This conference will now be recorded.
Okay, so now we're starting to record. So welcome everyone. We are here. We're thrilled to be here with you today. As you're starting to log on with us, we want you just to keep your microphones muted and to keep your webcam off. If you don't know how to do that or struggle with that, you can, Nazifa is here to assist us today, and she will do that. Nazifa will put her email address, and you can also choose her in the chat box. So there's a chat box where you can communicate with everyone or one of us. So if you're having any technological problems, you're welcome to join us that way, or to get some help from us. The other thing is that feel free to put your questions all along in the chat box. Nazifa is going to help us out, and she is going to keep track of what those questions are, and then we will pose them to Alessandra at various points if we feel like it, or at the end, whatever we kind of think needs to happen. So feel free to use the chat box. So our webinar today is co-organized by the, oh, sorry, I didn't know that was going to do that. By the European Network for Working with Perpetrators, and with Global Rights for Women and Pathways to Family Peace and the Family Violence Project of Maine. So we're excited that you're all here to be with us as part of this. And we will send you this PowerPoint afterwards. Today, we want to just take some time to introduce all of us. I'm Melissa Petrangelo Scaia. I'm the Director of International Training at Global Rights for Women, one of the founders and co-facilitators with John at Pathways to Family Peace, and train on men's perpetrator programs. And then also am one of the co-authors of a women's curriculum for working with women who use violence in a group process called Turning Points. John, you want to introduce yourself?
Sure, I'm John Heath, and I am from Maine, and I'm the Prevention and Intervention Director for Family Violence Project, doing work with perpetrators for the last 14 years.
Great, and we're going to have Alessandra introduce herself once she starts. We just want to do a couple other logistic things as people are coming on. Alessandra is our guest today, and we're just thrilled to have her. For those of you that didn't hear, Alessandra is joining us from Italy, and in Florence, Italy, and it's 11 p.m. there, so we're just very grateful that she is with us today from Italy. One thing that we wanted to just sort of talk about before we get started is, and this comes from a couple days ago now, when things change very fast here in the US, but from doing this webinar yesterday and with being in conversations with Alessandra, one of the things that we realized is that the context and the level of crisis of the coronavirus or COVID-19 here in the US is similar in some ways to what's happening in Europe, and not similar in some ways. And so, for example, just to give you an idea, is that here in the United States, not all states are in lockdown. I'm in Minnesota, and a number of the states surrounding Minnesota, North Dakota, South Dakota, and Iowa, as of a couple of days ago, had no lockdown measures. Yet we had a number of confirmed cases and over 3,400 deaths, and we're likely to be in lockdown through the end of April. And so what we want to say in context is that when you're listening to Alessandra, that what's happening, I'm always listening to what's happening in Europe in particular to learn about what's happening going forward. But, and now this is just my opinion, it's not based on science, but I'm not always convinced that people here in the US understand the urgent nature of this, of the crisis nature of this, in terms of the culture that I live in here anyway in the United States. So in part, we believe it's important to look to Europe because in some ways they're in a different stage of this than we are. So we do believe that there's a lot of lessons to learn. Alessandra has been in lockdown much longer than I have, for example, and we'll have her kind of talk about, say a little bit about that going forward. But we just wanted to sort of reiterate that with you. The other thing that we wanted to say to you is that this is the biggest question we think you have to think about first, which is if you're going to do work with perpetrators of domestic violence during COVID-19, during this pandemic, you're going to have to think about, you're going to do one of these three things. You're either going to do crisis management services, you're going to do no services at all, you're going to do nothing, or what's going to happen is you're going to try and take what you were providing pre-COVID now, but in a different format. So it's important for you to think about which it is you're going to do. Alessandra is going to talk with us about that. But for example, for those of you that don't know, John and I have been a part of an exploratory study since January 2019, where John and I partnered with researchers in the UK, Professor Nicole Westmoreland at Durham University, and a PhD researcher, Rosie Bellini. I'm not sure if they're on today. I know they're on yesterday. But in January 2019, John and I started a video conference men's group. So we use this technology to do men's groups, had researchers evaluated as part of an exploratory study. And what we have done with that is learned a lot in the last 15 months. However, you should know that when we started that, this idea of what we're in right now never even crossed our mind. So, but we know from doing that that there are a number of things that you have to consider if you're going to do video conference men's groups. And now what we've done is we started to say, what do you have to do if you're going to do video conference men's group during COVID-19? So John and I are most familiar with the United States context. I have some familiarity with other parts of the world, but most familiarity, of course, here. And so what we would say to you is that we're also learning. But what we'll provide to you after this, for those of you who are in the United States, is John and I have partnered with, and the leadership really of the European network, their guidelines, and then adapted them to the US context. We think they'd be relevant for places, especially like Australia, for example, to look at. So we'll send you some of those documents after here. So John, do you want to say anything else about doing those groups?
Well, actually, what I wanted to mention is just how that when we first spoke with Alessandra, the way that she had conceptualized the report and the recommendations, I felt like you and I sort of were like, we couldn't even get to there yet. And I feel like that is representative of everyone in the U.S. And so I'm really appreciative of Alessandra's input.
Yeah, it's been very, very helpful. So before we have Alessandra start, Nazifa, let's have you introduce yourself and just maybe reiterate how people can get a hold of you for any technical issues at all.
Absolutely, yes. So I am Nazifa Wazirzada. I am the program coordinator here at Global Rights for Women. I am helping oversee the webinar today. My email is in the chat box, and I'll put it again in there for those of you that are still joining us. But please feel free to put any questions in there, any concerns, any issues that you're feeling, feel free to email to, and I'm happy to help.
Right, and so just to reiterate too, is that this kind of happened at the beginning yesterday. People are still kind of logging on, but if Nazifa and I will end up turning off your webcam as you log in and turning off your mic. So thank you, Nazifa, for that. And so she will be there and helping us along the way. So we wanted to begin then, of course, today by having Alessandra begin by introducing herself and the organization that you work for.
Okay, well, thank you very much for having me yesterday and today, these two webinars. Thank you, Melissa, and thank you, John, for all the work that you've been doing before, during, and after connecting perpetrator programs throughout the world. My name is Alessandro Pouch. I'm the Executive Director of the European Network of the Work with Perpetrators. I've been working for over 20 years in the field of domestic violence. I worked for 15 years with victims of domestic violence in shelters. And I then founded the first perpetrator program in Italy. Currently, for about 10 years, I was running this program in Italy. Currently, I'm president of the national network of perpetrator programs in Italy, so they have obviously developed since. As also founding member of the European Network of the Work with Perpetrators and board member till 2 years ago when I became executive director. So I am now overseeing this organization that is really an amazing network of members. We have 60 members from 32 different European countries. Organizations are very different. We have small NGOs that are just starting out with perpetrator work. We have important networks like Respect from the UK that have many members themselves and are very, very well known and consolidated. So the variety and the differences is, I think, what makes our network quite unique. The network has organizations that are working directly or indirectly with people who perpetrate violence in close relationships, but also victim support services. So we are sort of representing many different nations and cultures, and this is, I think, one of the aspects for which we were immediately aware when this crisis started, of how some of the experiences that some of the countries had faced earlier could really be important for the countries that were following behind. And that's sort of when we started sharing experience. These guidelines are part of a collective effort of different organizations. There's specifically some service providers, for example, from a Russian organization, Men of the 21st Century, that have put in their experience and knowledge on online counseling to support other organizations. The board of WWP that has supported the work that we've been doing, and the organization in Italy in Florence, CAM, that has been working since the beginning, and very difficult situations because the programs were shut down from one day to the next, and so they have really sort of been on the cutting edge of trying to cope and manage and reflect and support others in developing activities. So what are we going to be covering during today's webinar? And I mean, if there are any questions or things that you would like me to specifically address, just please put them in the chat box, and so that I can answer and interact. It's wonderful having so many people there, but you're all just little shut cameras. So if you have questions and you interact with me, it makes it easier to respond more directly to you. So what will we be discussing today? We want to think a little bit about what our action plan for perpetrator programs in the COVID-19 crisis is. And so the things that we're going to be looking at in these guidelines are relevant for countries and perpetrator programs in the full range between still doing in-person work to people that are in total lockdown, because we know that there is a huge difference and different responses and different things going on. But the kind of information that we're providing, I think, is relevant for all, because many programs that didn't think they were going to be closing ended up within 48 hours completely shut down, and other programs that thought, well, maybe in a couple of weeks it's just sort of cautionary, have ended up being closed for over a month and a half. Obviously, I'm talking from the epicenter of one of the European epicenters of the crisis. Italy has been hit really, really hard by it. So we have had a very long shutdown at this point, and are really dealing sort of with the full impact of the virus. So we are going to sort of address from preparation to shutting down the program, and looking at the guidelines, how and who to prioritize, how to identify levels of risk, intervention, the goals of the intervention, and the setting of interventions, rules and options, something around victim support services, and really focusing on also themes around accountability and safety. I think it's very important when we begin to reflect on how we're going to address the issue, that we realize how much very often our services, the service providers, and the clients that we serve are really highly activated and anxious about what is happening. And sometimes anxiety just sort of drives us into action without really having thought through what our action plan is. And that can be really dangerous, because if we haven't really thought through all the steps of what we need to do, we might risk doing harm. And we know that during the lockdown and the COVID-19 crisis, levels of domestic violence have gone up. The situation is there are a number of heightened risk factors. So whatever interventions we think about and we want to set in place, we have to sort of carefully evaluate and think through what our action plan is. And we know most of us work in coordinated community responses. We know how important the context in which we work is. And so this is something that is the first thing that we really need to collect information and be really focused on. We need to consider the context in which we are living, our clients are living, what is the state of the lockdown, can people leave their home, how many people are effective, how many people are still working, how many are in financial strain, and for example, what are the measures that the government has taken to support that income? What is the state of supplies? How, if it's easy or difficult, is it to buy food or other supplies? So that's one of the first part, and that refers to the context. We also need to consider the social responses that are available, and we have to also think that these can change very fast. How and is the police responding to calls? Are the shelters still functioning? Will they take in new women? One of the issues that we've had to face is shelters not having space for quarantining the women that are fleeing situations of violence, and how do we make available spaces for them, and are they still able to flee situations in which they are at risk? What kind of support is the government giving to shelters for women if they need to leave the COVID-19 crisis? Are the courts still functioning? We've had a lot of pressure to try and use restraining orders or bearing orders to get the perpetrators out of the house, but in many of the countries, the courts are actually also not fully functioning because of the situation. So that also is something that we need to consider. Also, in this situation, there are obviously major stresses that the families are facing if they're in lockdown, social isolation, the fear of getting sick or loved ones getting sick, concern for the elderly people or medically vulnerable, fear of losing income or losing income over the course of time, fear about the economy and the whole crisis that is coming, often problems with public transportation, misinformation, difficulty in accessing supplies or medical help, having the kids out of school, the whole area of managing kids and having kids in homeschooling and all kinds of activities and childcare increases a great deal, and also dealing with other people's fear. So in this situation, the question is, can we use sort of normal curricular activities? We will be giving some input on this and trying to reflect on what sort of the best kind of materials to use in this phase. But pretty much, if we just sort of are reflecting on all these elements that I've highlighted, the context, the social responses, and the major stressors, it immediately seems that probably our normal curricular activities are going to be out of sync with what is actually happening. So to summarize the various situations in which people could be operating, you could be still running in service, in-person services, but you think that you may be facing lockdown, or you may have been recommended to limit in-person services, but still don't have a clear date of shutting down, or you may have been given a date for lockdown, but still have some time to prepare, or maybe you have been put in total lockdown with no possibility to prepare your clients. So if you are in a situation in which you can actually prepare for the lockdown, so you're still doing in-person work, these are some of the things that we wish we would have known before we were put in lockdown. Having the possibility of addressing what is going to happen, the COVID-19 and the challenges that are that will come up with this would have been really helpful. So running groups, there is some material that was prepared and made available by Chris Huffman, and you can find the templates for working with groups on this on our website. This is the link that you see on the slide. Collecting also information from the men on all their contacts, their phones, their emails. Some of this information maybe we already have, but sometimes it's not complete. Also, what kind of technological access do they have? Do they have phones? Do they have PCs? Do they have internet connection? And their level of technological literacy, because in some cases, some very simple things that can be done in person, like supporting somebody to download Skype or other platforms, can really help in providing access. Also, on the other hand, preparing service providers by giving them access to personal phones and dedicated numbers and SIM cards. This is an operation that up to a certain day was really simple. You could just buy a phone and a SIM card, but then it became really, really complicated when we were all in lockdown, and then we had to order them online. We had to order the SIM cards online. So this is also something that, had we been able to prepare better, it would have been easier. Again, there is a possibility that in this phase, it would be really good to sort of reflect on all these issues and be able to prepare an action plan with your key goals. So thinking about, what are my goals in this crisis? What do I want to obtain and how I'm going to do that? Also, problem shooting for high-risk situation and connecting with all services, with probation, other relevant services, child protection, in preparation if we think that this is the case, maybe providing a different location for the perpetrator to quarantine if this is necessary. In passing now to the line of action, given the situation of lockdown or in this specific situation, one of the most important things is what are our priorities, and the priority for us, for the Istanbul Convention, for the goal missions of WWP, is that we prioritize the safety of those who are affected by the violence in the intervention plan. And on the other hand, it's really important to also identify the level of risk of the perpetrator. In the situation when we're looking at the level of risk with perpetrator, there are specific questions that we want to be asking in this situation. Now, I'm going to stress that one element that applies to all the guidelines. So it applies to this, but it's a really important element. What we are talking about now is intervening in a severe situation of crisis, where there is a life-threatening situation, and short to mid-term response with heightened levels of risk for domestic violence. So the kind of reflections that we're proposing in the guidelines are not based on a lot of the reflections that we have been making over the years on perpetrator programs and behavioral change and psychoeducational programs. We know what we need to do in our programs to work towards those goals. The questions we need to ask now is, how do we prioritize the safety of women and children? How do we support our clients through the crisis so that the violence is contained and reduced? So when we're talking about identifying the level of risk, we are also looking at specific situations that are relevant in this context, which is, for example, screening the men that are living alone from the men that are living with their partners, ex-partners, or family. Because obviously, if the men are quarantining and they're living alone, the level of risk in which they are is, at least for physical violence, is a low risk category. Then I think we further need to screen for the men that are still working, and this also gives us a window into how safe it may be for the partners to be contacted by the victim support services. If the men are still working, there's probably a window for this, or also if the women themselves are working. We estimate that between 20 and 40% or higher, depending on the country and the level of lockdown of the men, as well as the percentage of the women, are probably working at all times. So this is also something to keep in mind. And the possibility of victim support services getting in touch with the victims is really important and really central, because that helps shape and guide the program and what we should be doing in this specific situation. Obviously, once these elements have been screened out, then we also are looking for our classical risk factors that we are probably already using in all of our programs, previous arrests for DV convictions, court-mandated clients, alcohol and drug use, previous severe episodes of physical violence, coercive controlling behaviors, high jealousy and controlling behaviors, low motivation to change, or doesn't take responsibility, whatever set of your risk assessment tools you're normally using, you should also use in this case, but screening out some of the other elements as well. So,
so if you're logging on, if you can turn off your webcam and Mike, that would help us. So Alessandra, this is a point yesterday where we kind of wanted to reiterate some things, and just to go back to that original point that we were making, that yes, what you're going to be talking about going forward is that generally based in your guidelines that you're going to be talking about next, is that you've decided in your guidelines that you're going to be doing crisis management. Is that a fair assessment, because that is the state of what's happening in Europe? And then it's not normal interaction with perpetrators.
Exactly. So at the initial slide, there was this question: should we be doing crisis management? Should we just not do any intervention at all? Or should we go on business as usual, just taking our normal groups online? So our initial assessment, and this is obviously based on a crisis situation, we're talking short term, we're talking crash interventions, often we haven't really had time to prepare on this, is basing our work on the do no harm principle. We want to be cognitive and recognize that the levels of violence are probably going to be heightened in the crisis. This is what our lessons from China tell us, and what is coming out pretty much throughout the world in the situation of lockdown, that the violence is going up. So through our contact with perpetrators, and again, we're going to have to sort of assess in different situations what kind of intervention should we be choosing. And the kind of indications that the guidelines are giving go in the direction of being accountable to the women and children that are living with the perpetrators at this time, and that may be at risk of increased violence. Right. And we'll talk a little bit more of how does this fit into an intervention program, because there are ways in which this space of crisis management can actually help us to also learn things and be able to work better in our program changes in a safe post-COVID situation. But what we need to look at now is, how are we going to address the situation now? How are we going to make sure that the women and children are safe in the homes of the perpetrators if we are going to be contacting them? Now, there may be situations in which that's just not safe, but what we have been hearing from the perpetrators that have been proactively contacted is that they really need the support in this moment, that they're really happy for programs to reach out to them, and that they are struggling with the situation and with the increased demands that the situation of forced cohabitation creates. So,
right. So I want to say, just sort of, Alessandra, this is an example, you know, like here in Minnesota, we've been in quarantine, you know, which is self-quarantine for about 3 weeks, but locked down for about a week. And one of the things that came out was, you know, the #1 call to the police, for example, in Minnesota, was 2/3 of the calls were domestic violence calls, right? So to your point, that we know some data is showing, of course, which is no surprise to us, that it's increasing. And I think sometimes the inclination for a lot of people who work with perpetrators then is the intervention should be about accountability. And just to kind of prepare people a little bit about where you're going to be going with this, is that you know, the European network, we've talked with you about this before, is saying that accountability is important, but not in this phase. We're not going to be in this phase forever, right? It's important to all of us, but to think about if that's what you want to have as part of your intervention, because as we've talked about, Alessandra, I'll just speak from the United States perspective and knowing a number of programs. There are some programs who spend a lot of time on accountability, right? So what the things you're going to be going into here in the next few slides are really going to challenge people because it's a different way. So I just kind of want to set the stage to prepare people, because when we did this yesterday and we kind of entered into this phase, you know, we're getting a lot of private chats and you know, we were joking with Alessandra that somebody sent me a message saying, do they coddle and cuddle abusers over there in Europe? What's going on, right? And I just said, no, see, this is the problem. We're not thinking of this as a regular perpetrator program. We're thinking of this in a particular time of life for all of us, frankly, right? And thinking about how we're going to keep women and children safe during this period of time.
Well, so one of my colleagues in Maine, Marty Burgess, actually, he's on, mentioned the other day that in a lot of ways, this is like, in the United States anyway, it's like right after 9/11, and we didn't do regular batterers programs in those few weeks after 9/11. And so it's a similar sort of process response.
Yeah, so I want to say that the European Network for the Work with Perpetrators is very concerned about perpetrator accountability. And it's an issue that we have reflected on, and that we have, there's actually an expert paper and there's a position paper that we have on our website. So it's certainly not something that is not at the center. It's something that is at the center of the work that we're proposing. And crisis management in this situation is very linked to accountability, to the accountability to women and children that are living with the perpetrators. So there may be some things that we are shifting in terms of how much we're challenging the perpetrators in this moment, because we want to keep the environment safe. But that doesn't mean that the long-term goal isn't and shouldn't remain on perpetrator accountability.
Right.
So in sort of back to what is crisis management? What are the goals of what we're trying to do? So we're trying to reduce the risk of violence, decrease the perpetrator's stress, increase coping mechanisms, mitigates the effects of violence on family members, and continue to reach out and try to listen to survivors' voices as much as that we can do that safely for the victim. So these are the specific goals that we have, and that is why we may be using different tools. Now, this doesn't mean that the service providers are switching off from all the things that they're attentive to always in their practice. They are learning from what is happening about also maybe how perpetrators react in their house, and they are learning a great deal of, they're gathering a great deal of information. The thing is that to be able to work with this information that they're gathering safely, they need to have a safe context, and they have a context, and they need to guarantee a safe context also for the victims of the violence. So we need to have a place that isn't the next room where we're working with the perpetrator to be able to address different kind of issues. Once we have set the intervention goals, our next step is that of looking at what kind of intervention can we use to reach those goals. And basically, and here's sort of the accusations of cuddling, I guess, come in, was providing support, facilitating emotional release, and increasing coping skills. Now, this is not sort of it's part of the work that we do in all cases with many perpetrator programs. It's not, we work on recognizing emotions, we work on trying to manage them, we definitely work on coping skills. The support part, maybe some more, some less. But in this specific context, because we are trying to create also containment of the violence and provide outlets, and this is going to be quite obvious also then when we get into sort of kind of actions that we're proposing and that we're trying out to be able to support in this specific situation is really it's really important, and it really helps to bridge to a more normalized situation.
Mm-hmm. So as an example, Alessandra, right, you wouldn't be challenging a man's belief system during this time, right? Like doing that sort of work is I think that, the term uses, I don't know if it was the term we used yesterday to sort of, get them heightened or, whatever, that challenging men, the goal is to respectfully challenge them, in the normal perpetrator program, that's not what we're doing at this time, that now's not the time to do that. And a term you used yesterday that I really liked was to considering that, we and the men have this life threat sort of hanging over us, and being aware of that, I think, is really important.
Yeah. Yes, I would subscribe to that. Okay, so before we get into the guidelines on the treatment, a couple of aspects, more general aspects on basic rules for online and phone intervention. Since we are going to be asking the men, and we are going to try and provide a lot of space, messaging, text for the men to freely access us with some rules that we will discuss. We also need to keep some boundaries on this. So service providers and men should not be friends on social media. The accounts that the service providers set up should be work-related and specifically set up, not their personal accounts. And service providers should have dedicated numbers and SIM cards to be able to work from home. As in terms of the basic intervention rules, we want to create as much structure as possible. This is a situation that is challenging. So give specific times to contact and make a plan. Just as much structure as you can give is helpful. Also, we are encouraging men to use messaging, any form of messaging that they're comfortable with, and to use it sort of as an outlet when they're building up, or to try and recognize what's going on. So the first part of exercise is like timeouts and that kind of thing, just using the texting to do that. But at the same time, there has to sort of be a clear initial rule that the service provider will not be responding all the time on the messaging. He will respond when he can, but that's not the sense of being able to use it for a little bit like a journal or a way of sort of expressing and trying to understand what is happening. The information that is provided can then also be used in the session, and even if there is an excessive use of the messaging, this again is something that we can then use in our post-COVID-19 sessions or in the group work and address issues around boundaries. But we're still learning things about how the men ask for help, how they relate to us. So we're using everything that's happening, and we will definitely get back to all that. Just we don't think it's safe to do it in this context. So this is true for all interferences in general. Everything that comes up and that normally we would deal with directly in the groups or in the in-person work that we're doing, in this specific instance, we just put it on hold and actually it would be good for service providers to take some written notes of things that are going on so that they make sure that they are addressed then after when they resume their normal session. So the guidelines on the intervention. And you will see that there are different letters that characterize the different, there's 4, A, B, C, D. I'm just pointing that out because then we have a flow chart, and at the end of the flow chart, there's A, B, C, D, so then you'll know what that is leading to. So individual intervention. So we can have an individual weekly support via Skype or phone. Sessions should be between 40 minutes and 1 hour, and every session you should allow at least half an hour at the end of the session. And this is needed to make sure that the man doesn't leave the session in sort of in a heightened emotional state. Wouldn't ideally be caused by what is going on with the service provider, just because we've talked a lot about sort of the crisis intervention assets. But however, the situation could just be upsetting for other things that have happened, and so it's always good to have that extra time. I have to consider that there is no sort of decompression. It's not as if the men get out of the group and then you can talk with the counselor afterwards, or they drive home or whatever. Their partner or the children could be just in the room next door. So this is something we have to always keep in mind. And in terms of the suggestions for activities for men, daily journals or diaries, using messages, WhatsApp, Telegram, or other services, using this to help the men express the emotions, try and figure out what's going on, trying to be more reflective on what is going on instead of reactive. It's really important in this period, and given that the children are often in the home because of the lockdown, we need to address and work specifically on childcare, how children can be affected by outbursts of violence. We might want to discuss unrealistic expectations the men may have of their children, and attitudes that are very strict or authoritative. So this is something that we need to sort of be attentive to. We can consider adapting specific materials. So this basically answers the question, should we be reusing normal materials in this specific situation? Maybe, I guess it depends on the materials that you have, but one of the really important things we think is that materials are revised so that they're pertinent to what is happening now. We have to make sure that they're simple, they're clear, they don't create frustration, they're not particularly challenging, they can be read alone and understood, non-threatening. So probably some of the materials are okay and some of the materials should be revised. Even a COVID-19 timeout would probably look something different from a normal timeout. They can't go out, maybe in some situations they can't go out and be in and walk around, but maybe they can go in their car. So trying to adapt to the specific situation. I do have at this point sort of an invitation. We are collecting the materials that service providers are preparing specifically for the groups, and we'll be sharing them with, we'll be sharing them on the website. So if you have some materials that you've developed or ideas around this, and you would like to share it with other service providers, please send it to us so that we can pool and start sharing them through the website. Another really important thing is providing the facilitators voice through audio recordings for the men. This could include maybe relaxation or reading out some materials, other different kind of relative readings. It's really important to stress that the voice of the group leaders can have a really soothing effect, and it can also cue the men into a series of associations that they have with the group, with that context, with the containment of the violence, and sort of a different way of working. So that is also something that we have found quite helpful. Consider making a schedule with the men so that they have some reference points in situations of uncertainty, especially for those that are at home from work. Discuss and evaluate what spaces of privacy they may have. And it's important to be flexible. One of the service providers discussing the situations was this, talking about, we usually have some pretty strict rules on the online etiquette, and definitely connecting from your phone is usually something that we wouldn't encourage, or connecting from the bathroom, which was in the specific case where the man had shut himself down to be able to have some privacy. So we want to be flexible, because in this specific situation, the circumstances are completely extraordinary. So also using gardens, garage, cars, or whatever is necessary. Providing information and ideas on constructive ways of spending time, interesting apps, ebooks or free audiobooks, cooking web pages, podcasts also. So that is definitely not our usual way of working with the men, but in this specific situation, it has provided support. So this is for situations. It said this is the case A, the guidelines on the individual is so when we have situations that are more at risk and we feel that the men need more intensive work, then we have some other indications of intervention. So we might suggest they're having short daily meetings, 15 minutes every morning, sort of a check-in, addressing what do you think could go well today? What do you think could go not so well? What do you think you could do to overcome what doesn't go well? So this might be daily. They might be every 2-3 days, and if in these intensive support where there are children in the household, and also that needs to be addressed, because obviously we have situations that we are evaluating as less safe, and so it's really important to assess about the children's safety and well-being. And additionally to this sort of intensive, short, brief, daily or 2 or 3 times a week, we would also suggest 2 or 3 phone calls or Skype calls as the ones that we discussed previously. In terms of the groups, so we've talked about individual sessions, we've talked about sort of intensive situations in which more frequent contact might be necessary. The third possibility is groups. There are certain specific circumstances in which also the group format might be considered. we feel that starting new groups is a little bit complicated. We would not encourage that. However, if there are groups that have met before and have previous experience together, there could be situations in which also the group format could be reasonably considered. The groups, again, the group work would be crisis group work, and there are certain very specific elements that sort of immediately make them quite different from normal group sessions. And for this reason, we think that before you should do some individual assessment on the situation with the men and clarify if they're interested in being involved in the in this crisis support group. That the group will have different format and rules from the regular group. Also because of privacy concerns, living together and having other people possibly overhearing conversations, the sharing might be limited and nobody is required to contribute. So there's a lot of space that people can actually just sort of listen into and be there, have the support from the other people, but not necessarily feel comfortable to share. Also, you inquire about the men's privacy concerns and if he thinks it would be possible for him to join him. In the case that you have had no possibility of doing the preparation work, this would be also the moment to find out what kind of a connection they have, if they know how to use the software that is necessary for joining the meeting, and supporting them technically in getting set up. In these groups, the content and discussion in the groups would be limited to catching up with each other in a supportive way and making sure everybody is okay and healthy. We saw that there was a great deal of anxiety that the men had in knowing that the other men were healthy and safe. If there is a check-in on violence, it should be limited to flagging concerns, and then eventually you would deal with that individually. It would be there would be several risks in doing that in the group format in this particular circumstance.
So, Alessandra, just a couple things.
Yep.
One of the questions that's coming up in the chat is about not having new men enter into this phase, right now that we're in. There's been some questions and comments about that. And so we'd like to hear from you that. Part of our reason for not accepting new men at this point is, most of the men who come to us are court ordered and they have quite a period of time to be able to connect. So we have the flexibility to be able to wait, and so we would prefer to because of what is happening. But can you comment about that a little bit, about whether, are you seeing some things about that and what's your thinking about it?
So of course it would depend on the format of the group. If we have a format of the group that is a running group and we have men that have been in the program for longer and men that are joining in, that would probably be more possible, because also the managing of the group dynamics would probably be held a bit by the other men. But still, you would have to have an individual assessment on the level of risk that putting this new man in the group that he doesn't really know. We know that the first sessions for the men there's a high level of anxiety, and that's just something that we're going to have trouble seeing when we're online. We're going to have these little figures. Yep. And are we going to be able to catch, the stress signs? Are we going to be able? It's really a question of considering that, do we have everything we need to make sure that the partners are safe? And I think that especially if we haven't been doing online work, and we have sort of a way of addressing these issues, maybe by doing some questions or other techniques and ways, we are at risk of not being able to manage very well the stress factor of a new group. And I wouldn't say, like, I don't know how long the lockdown is going to go on and what's going to happen to our future. And I would imagine if we go on for months and months, we're going to have to sort of revise certain positions. But again, I would stress that these are really extraordinary circumstances. So any court mandated, I think that it could be explained, the kind of circumstances that we're in, and the differences and the specificity, and the fact that there are some specific, there is a very specific situation, needs to be addressed as such. There is no reference point to this. So if normally we have, I don't know, 56 session with perpetrators, and they need to attend all these 56 sessions, if for 3 or 4 times they join a crisis management course and they have, I don't know, 25 sessions before and 25 sessions afterwards, it's just going to be a window in the life of that program. And it's going to be something that, if we manage it well, if we are able to be there for the men and their partners in the crisis, we are going to capitalize on that and then be able to have increased change afterwards. It's just a window in which we need to hold the space for it being safe, and we do that by being really, really attentive of the stress levels that we introduce in our practice. So, does that answer that?
Yeah. Well, and I think the big message here is what you've said. We're in an extraordinary time. We're saying, if you're going to do something, that you don't do what you normally do, right? So just to give another example of that, you know, John and I, and then you know, are doing the other group as well, and we're talking about, and I just want to say, you know, here in the U.S., and I mentioned this before, I don't think the level of people sense a level of crisis of this situation as much yet. You know, like the models we see in our U.S. news is that within the next 2 weeks, it's going to be really bad, right? And so I think that in part what we're saying, if you're going to have contact, make a difference. So just give an example, because we've been doing video conference groups for 15 months now as part of this exploratory study. We've had to say, what are we going to do differently at this time, right? And so we use the Duluth model curriculum, which has 2 sides of the curriculum. One is about power, control, and violence, and the other is equality. John and I, for example, have made a decision to only talk about the equality side, right, of the curriculum, which is to think about, you know, for the men who still can be in group, and we're able to do that because we've done a check with all the men, kind of where they're at and who they're living with, and we have, you know, we don't have that many men in our group, so it wasn't that hard. But the point more than anything is that we're doing something different during this time. And I think the other question that kind of came up yesterday too, Alessandra, is that because you're doing crisis management groups, right, based on these guidelines, and what John and I are doing, because we've been doing video conference groups for a while, is that when men come to our groups, our groups count towards their required number, right? And what you're talking about, Alessandra, is that you've stopped that, you've adjusted to make contact with perpetrators to increase safety for women and children, but it's not the same, right? It's about creating the safety. So I think that's the other practical question that's come up is, if they have contact with you, does it count, right? And I think that's what we kind of learned from you yesterday, and Jen and I thought is, you're either doing crisis intervention groups, or you've taken what you've done in terms of your behavior change groups and adapted it. And what you're talking about is crisis intervention, and those don't count generally, right? Is that correct?
Well, yeah, if we have sort of a curriculum and we have, just to simplify, I don't know, 15 sessions in which we're going to be doing 15 different topics. If we're doing crisis management for 3 or 4 sessions, we are not doing the session. So obviously those sessions need to be done. And the issues that are in the sessions are important and need to be addressed. And so that would be getting men off the hook for something that hasn't been adequately developed. So I think that the agreement, that's one of the reasons for which we say we engage and invite the men to participate in the crisis group. But it has to be clear for them that that doesn't necessarily mean, that might mean that they're going to have to do these extra 3 or 4 sessions, and it's their choice. Obviously, I would stress that this will be reported if men voluntarily decided to attend the crisis. I mean, when I'm reporting to the judge at the end of the program, I will say he's completed or he hasn't completed whatever sessions he had to do. But I will also talk about what happened during this crisis, because what happened during this crisis is where the violence is heightened. So what I'm doing now is relevant towards the evaluation of whatever is going to be happening in the history of the violence of this man. So it is voluntarily, but I think it would be strongly encouraged, and I think that there would be strong basis for saying this is going to be weighed in. It's not going to be the number of sessions that you have to do, but it is going to have its weight, and you make a choice here. Whether you stay engaged and you help us support you to be nonviolent in this period, or you just sort of tune out because they don't count.
Right. And I think the other issue is that if people are offering crisis management groups, then they don't count, right? But if you are offering another alternative, like John and I are doing video conference, right? And then offering it, if people are trying to do that now, there's a huge issue also about people's access to resources, about the internet, about technology, even telephones, right? And what does that mean in terms of that then it's only available for men who have resources as well. So I think it's something for us to think about in terms of this. It's also about how long is this going to go on, right? I mean, this could be months and months and months that maybe some restrictions are lifted, but maybe we don't start congregating in groups for a while. So, you know, I think that people are trying, you know, to plan. I don't think we're at the height of our crisis situation here in the US yet. You know, I don't live in a hot spot. I don't live in New York. I don't live in LA, right? So it's it doesn't feel that same way. It's my friends who live in those cities, right? So I think that we have to consider what's the level of the life threat, and what is it that women and children need to stay safe. So
there isn't going to be one size fit all. The guidelines are invitations to ask questions and to be aware of what the consequences of different interventions are going to be doing to the men, with the men, but also to the women and children that live with the men in the situation of lockdown. So there are obviously going to be a variety of different situations with different lengths of the lockdown and different severity in certain places. Most people are still working, in other places nobody's working. So there's going to be huge differences, and there's not going to be one solution fits all. I mean, even within the guidelines, there are, just as you were saying, certain service providers are working with some of the aspects of their programs, but the point that they are trying to adapt of all their curricular activities is just really being really mindful of of how they're proposing, what they're proposing, and how it can be received, and how this work can be done safely.
Right. Like one of the things that we found, you know, when Professor Nicole Westmoreland did this study, and with Rosie Bellini, the PhD researcher, you know, before COVID, one of the single biggest factors for success in a video conference group in terms of operating it is where he's doing it from, right? And so because of the current situation, you know, is he living with her? Does she work? You know, does he have some sort of space where he can participate in that sort of format, you know, alone or as part of a group process?
Some people are asking about like extended periods of time. If this goes on 6 or 8 months, are we still going to be doing crisis management? And
no,
right, yeah, I feel like that's sort of like an
anymore. It'll be the new normal.
Yeah, right. Yes, it will be the new normal. Yes, yeah, exactly, and that's why, you know, it was just timely for John and I to do this. So if this does become the new normal about, you know, how we connect with people, you know, what are the guidelines for how you do this? And I mean, John and I can tell you that in the last 15 months, we've had lots of unexpected things happen. Just to give one quick example, we had a guy who figured out that he was living with his partner. He assured us she was gone at work. Well, one day she came home early from work, and he figured out later that she was listening in through the door the whole time to the conversation. And that's obviously a problem, right? For many reasons, for her safety, for a lot of different reasons. And so you just learn, we've been learning a whole bunch of things doing this, and we'll share some of those guidelines from doing that. But it is a question of what if the expectation is that this lasts, you know, through the end of the calendar year, for example.
Yeah, so I think we don't know, and that's again going back to point one, dealing with our anxiety. But the fact that we don't know, I don't think is an excuse for not having sort of a program in place for the first phase. And the first phase is a crisis phase, and then obviously if things go on for months, then we'll adjust, we'll assess. But at that point, having done the crisis management well, we will have a much clearer idea. We will have contacted, or the victim services will have contacted the partners, so we'll have a feedback from the partners. We will have seen how the crisis has been dealt in the first few weeks. So we will have a lot of more information on which to base how to proceed with the intervention.
Right.
So last but not least is partner support services. So even if there are challenges, it's really important that we make every effort to maintain the relationship and the working collaboration with the partner support services, so that also we have information from what is going on from the partner's point of view. There are certain specific issues that are particularly relevant in this phase regarding the partners. If there is online communication going on, if we're using phones or chats, we need to be aware of how safety can be also compromised by technology. We need to make sure that the partners know how to delete their footprints. Also, I would invite everybody to also have a look at the information on stalkerware. This is a period in which, obviously, since the partners are living together, it's much easier to have access to your partner's phone. So it could be a situation in which stalkerware is installed in the partner's phone. Also, I mean, if somehow her partner knows everything that's going on in her phone, there might be some stalkerware. So And that's sort of a whole other chapter that we're not going to get into now, but that's also relevant.
So, Alessandra, can I just say one thing, because it's somewhat related, and there was a question about this, which is that these guidelines in Europe were written specifically about working with male perpetrators, right? There's a couple questions about that. Do these guidelines apply to working with women perpetrator programs? So can you just say a little bit about that?
Yes. No, these are guidelines for male perpetrators of domestic violence. In Europe, there are several programs that work also with women. Some of our members also have programs both for men and for women, but the guidelines, the reflections, and the concerns that are raised in this paper and in these guidelines are for male perpetrators of domestic violence. I'm not sure they would apply for female perpetrators of violence. I think there would probably be other concerns. So they were not, they're not gender neutral.
Right. Yeah. As a person who's worked with female perpetrators and done quite a bit of work on that, and Lisa Lawrence, I know, is on here, and I'm sure this is a question she's been thinking of, you know. And Lisa, please feel free to write in the chat box here about this. But you know, working with female perpetrators, I can tell you that they have been and I've worked with women now for 21 years as victims, and women who've come to those groups have been, some of them have a great high risk as victims themselves. They've experienced some of the worst violence I've ever heard in my career. So, and the level of stalking that women have experienced while they've been in our groups. And so we don't want you to just take these and apply it that way. It's in part why we haven't done video conference groups with women perpetrators, because the level of care you'd have to take to make sure that women can talk freely in that space would be extraordinary. So we really challenge you to think about that, and we should have a future discussion about that.
I'm going to just answer a couple of the questions that are coming into the chat, because some of these are interested. They may be interesting for other people. One of the questions is, I have a man who's 4 sessions away from completion of our program. It's down on 22 and 4 to go. What are your thoughts on a man completing a program where we're still in video group stage? So again, it's not going to be a one size fit all, but I would imagine that when there's a similar question even yesterday, I mean, when the man has almost completed the program, so they're, I don't know, 2 or 3 sessions away, I think it's quite thinkable that there could be sort of some individual work that is done with the man, or if it's in a group session, to complete the sessions. And also, I mean, it is a call of the service providers, because probably 22 sessions in, you pretty much know what level of change that man has arrived at, and those 4 sessions are not going to change drastically. So it depends. And again, there could be a negotiation also with the man and seeing how he deals with the crisis. Okay, even if you're doing something slightly different, but it's real life. You know, it's real life, heightened tension. Let's see how he fares on that. So I think it's a question about taking the responsibility of service providers, really thinking things through and adapting them to the various contexts. There's another question that I wanted to answer that is challenge for us is that we are funded to deliver programs, not crisis intervention. It may be well mean renegotiating with our funding body. I think this is a really, really important point. And in terms of the negotiations that I think we are all having to do with many entities within this crisis, as the crisis goes on, it's becoming more and more evident that normal standards do not apply in these circumstances. And funding bodies and institutional bodies have been receiving quite positively the inputs that we have as professionals in giving indications on how it should be done. So I think that that's a really really good point, but I think that it's something that we sort of really need to stand for in terms of, once we have the plan and we know what is best and we know why we're doing it and we know how we're going to be using it also in our programs, then we have to sort of then negotiate that is actually covered by the funding for the work that we're doing in this crisis, because often we have also the service providers that are working from home and that are facing the same kind of threat. So it's not as if we're in a different situation from that of our clients.
Right.
I just want to briefly say something about the finish on the last aspect of it, is the partner support service. So since we don't know if the woman is in a safe situation that allows her to feel safe to talk away from her partner and children, it can be a good idea to send an SMS message asking if she can talk on the phone or in a private setting. If she cannot talk, tell her that she could also communicate through WhatsApp or exchange emails so that she can have more privacy. And if you can proceed to the partner contact, or if the women's support services are proceeding with a partner contact, it would be good to assess the situation, the working situation, financial stress. Is she working? Is her partner working? Is she having financial difficulties? Are there children in the household? How is the managing of the children going? How are the children? How is the perpetrator's behavior affecting the children? Have there been more conflicts? Have there been other episodes of violence? Has she been able to manage them? If there has been no further violence, does she fear a new episode of violence? And also questions around managing the space in the house. If she is following the program, if she's able to keep contact with the victim support service. Also about any concerns that she might have about her partner being contacted by phone or Skype, and is she concerned that this might jeopardize her safety. Few last comments on feedback from partners that we've had. I think it's quite interesting. They were all pre-contacted through a message, and they felt positively about this. It gave them a better chance to organize when they could talk. They had concerns for the current situation and job instability, and that tends to lead to discussions and conflicts. Another area of conflict was managing children. There were a lot of difficulties around this, especially for separated couples, a lot of conflict whether the father should take the children. There were concerns for the health of the children, and that was definitely a complicated area. Most women reported that the psychological violence had increased. One man had been put on house arrest, and one woman had asked her partner to leave the house for the quarantine. Of the 5 minutes that were contacted, 2 were currently followed by the women's support services, and 2 felt that they didn't need it. All of the women felt that it was really important for the service providers of the perpetrator program to reach out for the men, and they felt relieved that the men were still being followed and contacted by the program. So that was very important feedback for us, that they did not feel that the contacts that were being made through the conferencing was a threat for them, but they felt that it was really important, and that it kept the men in check more. And
Alessandra, were there particular talking points that you used when victims were contacted by whomever they were contacted?
Yes. They were specific. They investigated these specific areas more or less with the questions that were also on the in the guidelines.
Okay.
Great. And then the last slide is on the links. So there's you find the guidelines and all these materials. Slides will be sent out by Melissa and John. And
great. So are there other questions? Nazifa, I know that there's maybe a couple that we missed. We just have a few minutes left, but Nazifa, did you see any that we could still?
So there's a bit of confusion on how I'm talking about partner contact, if it's run by the perpetrator programs or by the women's support services. And the reason for which this is a little bit vague is that throughout Europe, there are extremely different models. So there are perpetrator programs that are set up with independent women's support services, and that they work directly in collaboration only with the perpetrator program. And then there are perpetrator programs that work with women's support services that are doing the women's support service, but they also do some partner contact, phoning the partners directly. So there are a variety of different models, and I'm not endorsing, and I'm not getting into anyone being better than the other. I'm just saying we should get feedback from partners, be that with women's support services, independent women's support services that are doing support for the women. We need to get feedback, and we need to make sure that the work that we're doing is safe for them.
Great, thank you. So thank you so much, Alessandra, for your time here with us. It's just been so helpful as we're here with you. We just really, really appreciate your time and expertise. And I put this in the chat box, but we will be sending you on email with the PowerPoint with the recording. We'll also be sending you that recording. And we will be continuing this conversation. You know, things change so quick, right? Yesterday, for example, I talked about how, like, for example, Florida wasn't doing much, and then the governor finally put in a lockdown in Florida, except for, I don't know if anybody saw this, except for churches. They're not exempt from the lockdown, which is very concerning. So, you know, things are always changing, and we're just so grateful that we met you and that we've gotten to talk so much in the last week. And we will continue these conversations and hopefully get to see each other in person sometime soon. We also just want to say that Global Rights for Women here, we're going to be offering a webinar tomorrow on the court's response, how courts are adjusting and addressing in particular the safety of victims of violence for civil protective hearings, and whether or not courts are and the police are enforcing protective orders. So that'll be tomorrow morning. If you want to register for that, you're welcome to do that as well on our website, or just come through our GoToMeeting as well. I think John put that link up there. So we'll be doing that tomorrow at 10 and offering that recording. But we are just so glad that we could connect with you. You know, it's good to see faces and have some social engagement with each other at this time. So any last thoughts, John, Nazifa, Alessandra?
Just appreciate everybody joining. I just appreciate everyone joining, so thank you.
Yeah, I really wanted to thank you, Melissa and John, for this opportunity. It's just been amazing to be able to connect to so many professionals from so many different places, and to sort of share what we're doing, but also learn and feel less isolated. I mean, I think it's really been a great opportunity of just pooling resources and seeing, the crisis opportunity. Yes, it's a crisis, but it's also been an opportunity to do some amazing things and to get to know each other better. So really, thank you for this.
Yes, and thank you for staying up. We just want to remind people it's 12:30 a.m. in Italy, where Alessandra is. So,
Wow.
and for those of you who are joining us from Europe, we know it's late. So go rest, get some sleep, and we will be in touch shortly. Okay, thank you, everyone. We're going to log off now, and it will log you off and disconnect you. So thank you again.
Thank you.
Look for an email from Nazifa. She will send you an email. Bye.
Bye. Thank you.
Thank you, Nazim.
Thanks.